But there's a component of early detection that we don't pay enough attention to. And that's that most people believe that a disease like cancer is going to occur to other people and not to them. And in young people, unfortunately, they tend to ignore the fact that cancer can occur in the young and be very significant and very difficult for them and, in fact, lethal. They tend to think they're immortal. So spending more time with early detection, not so much on the technology issues like mammography and pap smears and colonoscopy, but spending more time getting people to understand their own health, to understand what is normal for them, to understand variance relative to what is normal, to understand also that if symptoms develop, which symptoms are important and which are not, and what should they do about these symptoms if they last more than 2 weeks. In addition, if they make the decision, the correct decision, namely to report symptoms that have lasted at least 2 weeks to medical professionals, they need to know how to advocate for themselves with the medical professionals. They need to know what the professionals want to know, or at least have a strong hint in that regard. And if they know this sort of thing, they can determine what should be done for themselves, they can determine what they want to have done for themselves, and they can run this by the physician and his thinking or her thinking and come up with a game plan that makes sense.